And I'm also going to report maple syrup urine disease. Maple syrup urine disease. It is a rare genetic disorder characterized by deficiency of certain enzyme required to break down the three branch chain amino acids, the leucine, isoleucine, and valine in the body. The result of this metabolic failure is that all three BCAs, along with their various byproducts, accumulate abnormally throughout the body. The disease typically begins in the early infancy. The scientific name for MSUD is branch chain ketoaciduria. The condition gets its name from the distinctive smell of the urine of children who have it. For etiology and cause, MSUD is caused by changes in three different genes: BCKDHA, BCKDHB, and DBT. Mutations in these genes result in absent or decreased activity of human branch chain alpha ketoacid dehydrogenase complex enzymes. These enzymes are responsible for breaking down the branch chain amino acids leucine, isoleucine, and valine that are in protein-rich foods. Accumulation of these amino acids and their toxic byproducts results in the serious health problems associated with MSUD. The toxicity of these amino acids seems to be restricted to the leucine. Indeed, extra valine and isoleucine are often given during treatment. Accumulation of their respective ketoacids results in metabolic acidosis. Parents who are close relatives have a higher chance than unrelated parents to both carry the same abnormal gene, which increase the risk to have children with a recessive genetic disorder. MSUD is inherited as an autosomal recessive genetic condition. Recessive genetic disorder occur when an individual inherits two copies of an unaltered gene for the same trait, one from each parent. If an individual inherits one normal gene and one gene for the disease, the person will be a carrier for the disease but usually will not show symptoms. The risk for two carrier parents to both pass the altered gene and have an affected child is 25% with each pregnancy. The risk to have a child who is carrier like the parents is 50% with each pregnancy. The chance for a child to receive normal genes from both parents is 25%. The risk is the same for males and females. Types of MSUD. Classic MSUD. This is the most common and severe form of the condition. A person with this form has little if any enzyme activity, about 2% or less of normal activity. Symptoms are present in newborns within a few days of birth. Onset is usually triggered when the infant's body begins to process protein from feedings. Intermediate MSUD. This is a rare version of MSUD. Symptoms and age of onset vary greatly. People with this type of MSUD have a higher level of enzyme activity than classic MSUD, about 3 to 8% of normal activity. Intermittent MSUD. This form doesn't interfere with normal physical and intellectual growth and development. Symptoms usually don't appear until a child is between 1 and 2 years of age. It's a milder form of classic MSUD. Individuals have a significant enzyme activity, about 8 to 15% of normal activity. The initial reaction of the disease often occurs when the child experiences stress, illness, or an unusual increase in protein. And for thiamine responsive MSUD, this rare form of the condition often improves with large doses of thiamine or vitamin B1. Symptoms usually occurs after infancy. Even though thiamine can be beneficial, dietary restrictions are also necessary. Here we have the disease process shown on the diagram. Risk assessment. Your risk of having any form of MSUD depends on whether your parents are carriers of the disease. If both parents are carriers, their children has a 25% chance of receiving two mutated genes and having MSUD, or 50% chance for receiving only one defective gene and being a carrier, or 25% chance of receiving one normal gene from each parent. If you have two normal genes for BCKDC, you can pass the disease to your children. When two parents carry the recessive genes for BCKDC, it's possible for one of their children to have the disease and other children to not have it. However, these children have a 50% chance of being carriers. They also may carry a risk later in life of having a child with MSUD. For signs and symptoms, some initial symptoms characteristic of classic MSUD are lethargy, poor appetite, weight loss, weak sucking ability, irritability, a distinctive maple sugar odor in earwax, sweat, and urine, irregular sleep patterns, alternating episodes of hypertonia and hypotonia, high pitch cry. Signs of intermediate and thiamine response MSUD include seizures, neurological deficiencies, developmental delays, feeding problems, poor growth, and a distinctive maple sugar odor in earwax, sweat, and urine. For diagnostic tests, plasma amino acids testing should be performed to assess for elevated levels of branched-chain amino acids and to detect I-alloisoleucine. When symptoms show up after the newborn period, diagnosis of MSUD can be made by a urine analysis or blood test. A urine analysis can detect a high concentration of keto acids and a blood test can detect a high level of amino acids. The diagnosis of MSUD also can be confirmed with an enzyme analysis of white blood cells or skin cells. If you are concerned that you might be a carrier of MSUD, genetic testing can confirm if you possess one of the malformed genes that cause the disease. During pregnancy, your physician can use samples obtained by chorionic villus sampling or amniocentesis to diagnose your baby. For nursing diagnosis, first is risk for delayed development related to elevated branch amino levels. Second is imbalanced nutrition less than body requirements related to inability to absorb nutrients. Third is deficient fluid volume, vomiting related to elevations of BCAA. For nursing interventions, discontinue all natural protein containing products immediately. Consume extra calories and control of electrolyte balance and osmolarity. Continue synthetic protein, leucine, isoleucine, and valine depleted amino acid mixture either orally or via nastrogastric tube if possible. For medical interventions, dietary therapy, hemodialysis, and peritoneal dialysis. For pharmacological intervention is thiamine. For surgical intervention is orthotopic liver transplantation. For the nursing care plan, needs, problems, and cues, physiologic risk, risk for delayed development. Risk factors, two parents carrying the recessive gene for BCKDC, seizures, neurological deficiencies, and feeding problems. Nursing diagnosis is risk for delayed development related to elevated branch chain amino acids levels. For scientific basis, in maple syrup urine disease, the metabolic defect is branch chain alpha keto acid decarboxylase, an enzyme complex encoded by 6 genes. A mutation in any of these genes can result in accumulation of alpha keto acids in the urine, which produces an odor somewhat similar to maple syrup. Failure to limit branch chain amino acid intake can lead to mental retardation, seizures, and death in individuals with MSUD. And for objectives of care, general objectives, after 7 days of student nurse client interaction, the client will prevent developmental delay as manifested by a reduced leucine level to acceptable levels. For specific objectives, after 2 hours of health teaching, primary caregiver will understand the cause of development delay as evidenced by explaining the cause with his or her own words, enumerate ways to stimulate patient to promote developmental advancement. And for nursing interventions, measures to prevent delayed development. First, participate Participate in screening the child's developmental level by means of observation and history related by concerned significant others. Developmental delay occurs when a child fails to achieve one or more developmental milestone within an expected time period. Second, promote activities and interactions that support developmental tasks to keep the client's current status and potential. Third is encourage setting of short-term realistic goals for achieving developmental potential. Small incremental steps are often easier to deal with. Fourth is collaborate in a multidisciplinary screening evaluation to assess clients' developmental in areas of gross motor, fine motor, cognitive, social, emotional, and adaptive and communicative development to determine areas of need possible interventions. Evaluate environment in which long-standing care will be provided to determine ongoing services, other needs of child and care providers. Six is note chronological age and review expectations for normal development at this age to help determine developmental expectations. Seven is evaluate client's progress on continual basis. Identify target symptoms requiring intervention. To make referrals in a timely manner and or to make adjustments in plan of care as indicated. Eighth is document leucine levels to maintain leucine levels within normal range. Ninth is perform urinalysis on each void to determine presence of ketones or glucose. 10. Administer thiamine as prescribed. Important in coenzyme and amino acid metabolism.